Have you ever heard the term potency pills? It is a term often used to describe the little blue pills that supposedly restore a man's virility instantly. But how much do you really know about how they work in the body? Beyond the hype, erectile dysfunction drugs are one of the most remarkable medical discoveries, but also one of the most frequently abused. In the hands of a doctor, they can save a man's marriage and self-confidence. But in the wrong hands, they can pose a serious threat to the heart and blood vessels. Tonight, we'll discuss scientifically and without taboos how erectile dysfunction drugs actually work, why they're effective, what their side effects are, and how the body responds hormonally, circulatory-wise, and psychologically. Erection mechanism, how the body works. Before understanding the drugs, we must first understand how the male body naturally reacts. An erection is just about arousal. It is the result of a collaborative effort between the brain, nerves, hormones, and blood vessels. When a man is aroused, the brain sends electrical signals to the nerves in the male reproductive organs. These nerves release a chemical called nitric oxide, NO. This substance causes the smooth muscles in the blood vessels in the area to relax. The result? The vessels dilate. Blood flows more rapidly into the spongy tissue called the corpus cavernosum, and the organ tenses. However, the body also has a regulatory system to prevent an erection from lasting forever. An enzyme called p5-phosphodiesterase type 5 breaks down cGMP, a compound that keeps blood vessels open. Once cGMP is destroyed, blood flow decreases and the erection gradually subsides. And this is where erectile dysfunction medications come in. How erection medications work. Medications like sildenafil Viagra, tadalafil Cialis, and vardenafil Levitra are PDE5. They work by blocking the PDE5 enzyme, preventing cGMP from breaking down as quickly. This allows the blood vessels in the male reproductive organs to remain relaxed longer. Blood flow is maintained, and an erection can be maintained. It's important to note, these medications do not automatically cause an erection. Without sexual stimulation, no nitric oxide is released, so the drug won't work. So, its function isn't as an arousal trigger, but rather as a supporter of the body's natural physiological processes. Types and duration of action of medication. Each medication has a different duration of action. Sildenafil Viagra starts working in 30 to 60 minutes, lasts about 4 to 6 hours. Tadalafil Cialis effects can be felt in 15 to 30 minutes and last up to 36 hours. Hence the name, weekend pill. Vardenafil Levitra, similar to Viagra, but with less effect on blood pressure. Avanafil Stendra, the newest generation, starts working in 15 minutes with mild effects. However, they all work on the same principle, increasing the response to stimulation. These medications are most effective when taken by men who experience erectile dysfunction due to narrowing of the blood vessels, diabetes, or chronic stress. The role of psychology in an erection is truly a combination of physical and mental processes. Anxiety, stress, guilt, and emotional distress can block signals from the brain to the male reproductive organs. Many patients are physically healthy, but fail to achieve an erection because their minds refuse to believe in themselves. This condition is called psychogenic erectile dysfunction. In cases like this, erectile dysfunction medication can provide temporary relief because it provides positive feedback that the body is still capable. However, long-term recovery still requires psychological therapy and communication with your partner. Common and serious side effects. Mild side effects that often occur include headache, face, flushing, nasal congestion, temporary visual disturbances, bluish tint, back pain. This effect occurs because blood vessels dilate not only in the organ area, but also in other parts of the body, such as the head and eyes. However, the most dangerous is when this medication is used in conjunction with nitrate-type heart medications, nitroglycerin, isosorbate, dinitrate, etc. The combination of the two can cause a drastic drop in blood pressure and sudden death. People with severe heart disease, low blood pressure, or kidney problems should also be careful. The dangers of misuse and counterfeit products. The biggest problem isn't with the official drugs themselves, but with counterfeit and fake herbal products sold freely online. Many natural or herbal male enhancement products actually contain sildenafil or tadalafil in unclear doses. Without medical supervision, excessive doses can trigger heart problems, sudden fainting, and even stroke. WHO data shows that more than 50% of erectile dysfunction medications on the online market are counterfeit. Some contain heavy metals, steroids, and even That's why the use of these medications should always be based on a doctor's prescription. Natural alternatives and holistic approaches. Besides medical drugs, there are natural approaches that can improve vitality and blood circulation. Red ginseng increases the release of nitric oxide. Tonkat, aliuricoma, longifolia helps increase natural testosterone. L-arginine, an amino acid that helps produce nitric oxide. Ginger, honey, and citrus fruits improve peripheral blood flow. However, these ingredients are not a substitute for medical treatment, tonally long-term health support. The effects are mild and gradual, not instant. Regular exercise, adequate sleep, and stress management have also been shown to help testosterone production and improve blood flow. Facts often misunderstood. Erection pills do not increase penis size. They do not cause physical dependence, but they can lead to psychological dependence if misused. They do not work without sexual arousal. And most importantly, they cannot replace communication and emotional intimacy with your partner. An erection is simply a bodily reaction, but closeness, trust, and affection are the true fuels of a healthy relationship. Conclusion and health message. Erection pills are a testament to scientific progress, a real solution for men who have lost confidence due to physiological disorders. But, like a double-edged sword, their benefits are only felt when used wisely. Before looking for a quick fix, first understand the root of the problem. Is it due to stress, lifestyle, illness, or hormonal factors? Consult a doctor and have your heart, hormone levels, and blood sugar checked, because truly, male vitality isn't measured by how hard your organs work, but by how healthily your body and mind work together. Balance is key, and education is power. That's all for today's video. I hope it's helpful. Thank you for watching, and see you next time. Bye!